Hello, hello, and good morning, good afternoon, good evening, good night to all hygienists and oral therapists joining us today from all over the world for this special introductory of the IFDH Social Responsibility Project. My name is Sharon Friedman Yaniv. I'm a member of the IFDH House of Delegates representing Israel and the chairwoman of the IFDH Social Responsibility Committee. I've been a dental hygienist for the past 25 years, and I'm a past president and current CEO of the Israeli Dental Hygiene Association. I work in private practice and I'm involved in public and community oral health projects in Israel. Joining me today on this special webinar is Wanda Fedora, president-elect of the IFDH, and Jill Rethman, member of the House of Delegates representing the USA, and a member of the Social Responsibility Committee. Along with Jill and Wanda, I wish to acknowledge the contribution of our wonderful ladies in the committee working together with us, Veronica Montebello representing Malta, Carmen Lanaway representing Germany, Jacqueline Boss representing Switzerland, Elaine Johnson representing South Africa, and Tracy Bowser representing Canada. I would also like to acknowledge and thank Dentsply Sirona for their ongoing support of the IFDH Social Responsibility Project. Now, we all know the important role of dental hygienists playing in promoting oral health. Whether in private settings or community settings, dental hygienists have a major impact on their patients' understanding of preventative measures and oral health. Programs such as Florida applications, school dental sealants, dental health education, tobacco cessation, nutrition, and so on. Obviously, during COVID times, we all had to face more challenges and needs to be adjusted. Social responsibility projects dealing with oral health and prevention enables hygienists to get the message across in non-traditional clinical setting to certain target groups, those who are more vulnerable and unable to come to us. We'll provide them with valuable knowledge and tools sufficient enough for them to maintain good oral hygiene and thus improve and maintain their oral health for a better, higher quality of life. If you haven't yet have a social responsibility project or activities in your community or country, the IFDH encourages you and gives you a great opportunity to do so. You are more than welcome to share these projects with us, to have them presented at the IFDH in Dublin, Ireland, this coming August 2022, and have a chance to receive an award. This year, our theme is empowering women. I would like to invite Jill Rethman to give our committee's outlook on how and why we had come with this theme. Please, Jill Rethman.
Thank you so much, Sharon. I have to say it's such a pleasure to be here with all of you today to talk about this important initiative from the IFDH. We've chosen the theme, Empowering Women, Gracing Our Faces with Healthy Smiles. And when the committee looked at various themes that we could choose, we thought this one was very important for the times that we're living in. Our initial social responsibility program that took place in Brisbane, Australia in 2019 did not have a theme. So the committee thought, well, let's look at various issues that are facing people worldwide. Let's look at ways that we can have an impact to improve oral and overall health. And empowering women was the theme that was actually brought forward by our wonderful chairperson, Sharon. And the committee overwhelmingly thought that this was an excellent theme to choose. And the reason for that is by empowering women and creating awareness about the improvement of oral health, we know that that's a vital topic because oral health impacts overall health. It creates better oral health, creates greater self-esteem for all individuals. And I know we've all seen that with patients that we've treated in our practices and family members even that we've counseled and helped. Women care for their children, they care for their spouses, they care for their aging parents, they have social circles where they have influence. And so if their influence regarding better oral health can have an impact in all of those circles, it could have a ripple effect all across everybody that they come in contact with. And so that's why we thought this theme was so broad in scope and so important that we chose it. And in fact, we've put together, Sharon has put together this really nice video to show women in their elements and to also explain why we thought this theme was important. So Sharon, if you'd like to show the video. Thank you, Sharon. And again, thanks for having me as part of the panel today.
Thank you, Jill, for your hard work. You're wonderful. And I really appreciate what you do for our committee as well. And next, on the how, who, where, all questions that you have for this on this next presentation that Wanda Fedora will be giving. Wanda Fedora is the president-elect of the IFDH, and she has lots of experience that she's going to share with us on how we initiate and engage in social responsibility projects. Wanda?
Thanks, Sharon. Hi, everybody. I'm coming to you today from beautiful Cape Breton Island on the east coast of Canada. I am the president-elect of the International Federation of Dental Hygienists, and I've also had 41 years in dental hygiene. And over those years, I've participated in many social responsibility projects, everything from speaking to brownie groups to hiking through the jungle of the Guyanese country in South America so that I could provide care in the isolated villages. So I've had many social responsibility projects. I'm especially excited about this theme about empowering women because, as Jill did say, women impact the lives of so many others around them, and they make such a difference in the world that empowering women will bring a difference to oral health. So where, if you were thinking about starting a project, you might ask yourself, where do you start? And when I've been planning projects over the years, I usually start in the same way by forming a committee. So we don't want to start on our own because the more ideas that come together, the more robust your project is going to be. So when you're reaching out to form your committee, you might want to check with your colleagues, other dental hygienists you know well. Take advantage, of course, of social media to reach out to a wider range of dental hygienists. There may be other people that want to participate that may be in other parts of your country, other parts of your community, but a core group is necessary. You're going to need
excuse me, Wanda, do you want to share the presentation?
Oh, I am sharing.
We don't seem to see it yet.
Oh, sorry.
Okay.
Just 1 second. I'm going to try that again then. Sorry about that, guys.
No problem.
Okay, let's try share screen. I'm going to go down to my, yeah, it's not there. Okay, sorry. I'm going to open it up one more time. Bear with me, everyone. All right, here we are. Are we sharing?
No, it doesn't
Okay.
seem to.
Share screen. Try that. Are we better?
Okay.
There we are.
Ready to
Sorry,
roll.
everyone. You could hear me. Now you're going to have to hear me one more time. So no, we'll go back to where do we start? Forming a committee. So remember, you want to reach out to your colleagues. You want to be working with other dental hygienists, but also other people in the oral health world, because we can all work together. So I've always found that a nice core group of people to bounce ideas off, to be able to think about the things that need to be done. You can add more people as you go along. As you get close to your target date, start with a small core group that you can easily contact, easily meet together. So when you choose your target group, you're going to want to think of who do you want to reach out to. Now, possibly you're someone who enjoys working with new mothers. You may be inclined to feel empathetic to women in safety shelters, such as women's shelters. Is your geographic area a haven for refugees? Many of our countries are facing that today. And also, do your long-term care homes need oral health care initiatives? Because the elderly women in our community as well would benefit from a healthier and nicer smile. Lots of countries today have opened their doors to immigrants because of the need. And many of us have immigrant women's associations in our areas where they can reach out to the immigrants and they can possibly have translators and people that understand their culture maybe a little better than we do as the welcoming country. And what about a women's back to work initiative? There are lots of cities and countries today that have initiatives where women are starting to come back into the workforce, possibly after raising a family, or even young mothers who possibly have finished an education and now are looking for help getting started. So you're really only limited by your imagination. You put 4 or 5 of you in a room together and see the list you'll come up with. Then it's time to develop a realistic plan. So you want to pick a date or dates for the project. So is a weekend most convenient for your volunteers? Because as dental hygienists, a lot of us are working from Monday to Friday. But what is the best date for your target group? It may be that Monday to Friday is the best time for them, and you may have to look at working with dental hygienists that have a flexible schedule. But give yourself enough time to be prepared. Don't try to plan it Monday and execute it 2 weeks later. You want to make sure you have enough time to do this comfortably, because it won't be enjoyable if you put it too fast on your agenda. Sorry. So what about a venue? Where are you going to hold this? Well, of course, it's going to depend on what is it. So be sure your target group can get there. If you're going to hold this for them, you want to make sure they can actually access you. You may have to go to your target group. So pick a venue close to them or where they meet. Now, if you're looking to set up an event, you may want to get the space donated, possibly a local dental school, dental hygiene school, even a dental assisting program, somewhere where chairs are available and you can provide care. If it's going to be oral health instruction, then simply a room, possibly with audio visual available, would suffice. So as I prepare for the projects, whether it's going to the Guyanese jungle or going to the brownie group, I like to walk myself through it in my mind from the time I start till the time I stop. I like to step through each step of the way. So remember to consider what you're going to need to complete your task, from welcome to au revoir. So signage. Do you want, if you're in a building, you're going to have to put up signs to tell people where to find you in the building. You're going to need a registration form, possibly if you're going to provide care for them, because you're going to have health concerns to look at, possibly waivers for photos, because if you're going to send your project into us at IFDH with some photos included, which we hope, we'd like you to get in your permission from the participants to share their photos. You'll need oral care products. You're going to need all the things to do the job you do: gloves, masks, shields, etc. In this day of COVID, we have to consider all the PPE. Headlights, of course, if you're doing an examination outside a clinic. So if you're going to do an outreach in a refugee camp, you're going to need to have a headlight on with loops so that you can see properly what you're doing. And one thing that I find quite often we forget: garbage receptacles. We have everything we need to do, and then we have nowhere to put it when we have to get rid of it. So you should also consider, in your group of core volunteers, who is the contact person? You don't need people with 4 phone numbers to reach out to. You want one person in charge of media. You want one person that is collecting participant information and registering them. And then one person, that same person, should be that person that the volunteers go to when they're looking for answers to their questions. So now you've decided where you're going to go, who you're going to participate with, what you want to do. What about access to sponsorships and donations? Because all of this is going to possibly cost some money. If you're going to advertise, you may have to pay. If you're going to make posters, you have to buy the paper and the bristle board and things. You have to have them printed, possibly. You have to have your oral care products. All of this can cost money. So what type of expenses would you anticipate? Oral care products, toothbrushes, your paste, rental of a facility, your interpreters may need to be paid, transportation sometimes for attendees, lunch for volunteers, because if you're going to spend a day doing something, you have to try and feed the people that are volunteering with you. Consider your printing and advertising costs, and thank you cards. I've always found a thank you at the end of the day went a long way to making people feel appreciated. So when you're talking about contacting your group, what's the best way to let them know about you? Possibly there's an event in the area and you can participate in that event, like a seniors expo, or you could have an event where young mothers and babies are coming together. Sometimes there are mother-baby yoga classes, and then there are also empowering women courses that help them to get back into the workforce. And so you want to look to see in your community if there are other events that could possibly include your group so that you can work together. You can also use social media, which of course today is the favored way of advertising. You know, if you have an Instagram account, Facebook, let people out there know. But in some cases, people may need a paper poster. If you're working in a refugee camp, they may not have access to social media. They may not have cell phones and Facebook. So you may have to go there and actually show them who you are and when you're coming. Your community also may have free press where they advertise on TVs, in newspapers. And then if you're brave enough, you could appear on a local radio or TV show to promote the project. That's actually how we do promote our free dental hygiene day here where I live. So it could be possible, I guess, to have too many volunteers, but it's unlikely. So I suggest schedule your volunteers for short periods to lighten the workload. So if you have a full day project, anywhere from 2 to 4 hours of volunteering is probably enough for most people. You know, happy volunteers will come back again if they've enjoyed their experience. So be sure though to know who your volunteers are. Are they actual dental hygienists? So always make sure you check credentials and make sure that you are, because you would be liable for any activities held on site. So, but we also love to include others for clerical and support. So seeing dental hygienists in action is always a great way to promote our profession. So when we use the local dental assisting school, we quite often use some of the dental assisting students to help us with registration and cleanup and decorating and whatever other small jobs we need help with. So on program day, I always like to have a running plan. So if you need to decorate or set up, you can do it the day before, the night before, so that that morning you're ready to go. And like I said before, there should be one key person to troubleshoot and be available to answer questions from your volunteers and your participants. Walk yourself through the day. You welcome people as they enter. You register them to know who's participating. You provide your intended services, whether that be oral hygiene instruction or actual clinical care. Make sure your volunteers know what they're going to be doing and that everyone has a job. We want everyone to feel included and welcome, and they want to feel that they've done something at the end of the day. Then after you've discharged your participants and your volunteers hopefully have been fed, it's time to clean up. And that's where your garbage receptacles always come in. So always put those garbage bags in that box of goodies before you leave home. One important aspect that is really important to a lot of reasons is keeping records, not just of the amount of money is spent or the amount of money you're not going to collect, of course, but the amount of money that was donated. Because at the end of a project, you want to show what not only its value to the recipients was, but to the overall community. So when you get donated toothbrushes, include the value of those in your report. All the other donations as well. So at the end of the day, you know what the cost of that program would have been had you not had the value of those donations. It's great as well for future reference. So you know what this type of project could cost if you didn't have the sponsorships in place. And then you can recommend what you would do if you held this again. So at the end of the day, say, how would we do this differently? Or do we think this was the best way to carry it out? That way, if you decide to do this project another time, you've got lots of references to go back to. And we want to know at IFDH how your project went. And when you send in your report to us so that we can look at it for Dublin next year, we'd love to know how much care was provided, what type of care was provided, and what the value in dollars that might have been had these recipients had to pay for that. And a thank you, as I said, is worth more than money. Appreciate the people that have volunteered. Thank those that have allowed you to provide care to them. Thank them for showing up, because without them, the project isn't able to carry off. You can do all the planning you want, but if your target group doesn't come or you don't reach them, then unfortunately it's not that great a success for you. So make sure that you thank them for participating as well. Thank your sponsors or your donors, then save your program for another day. Because once you've had a successful program running, you're going to want to do it over and over again. I'm going to briefly tell you about a project called Gift from the Heart here in Canada. I've participated in many projects, but Gift from the Heart, I have been active with for 6 years now. And what we do is we decided we wanted to have a free day, a day where we provide free dental hygiene services to the people who don't have dental insurance, people who can't access dentistry because it's too expensive for them. This project started in Ottawa, Ontario, and the dental hygienist who decided to start it in her private clinic thought, why don't I reach out to other dental hygienists in private clinics and ask them to participate with me? And as it grew over the next few years, it spread across Canada, where we have every year hundreds of clinics opening up for one day, providing free dental hygiene care to people from coast to coast. It's a fantastic project. So when we decided to start a project here in Cape Breton to join them, we thought, well, where would we work first of all? Well, there's our venue had to be a clinic of some kind, and a local dental assisting school volunteered their location for us for the day. We decided that we would like to book our volunteers on a 4-hour basis. So anybody volunteering to work for free would only have to work 4 hours. And then other dental hygienists who were there as well would clean their instruments for them, bag them and sterilize them. What a treat not to have to do your own instruments. So that was a nice surprise for everyone. And we had some clerical staff from the dental assisting school help to welcome people, bring them in, and then they would also help to escort them at the end of the day. And if someone needed transportation, we had secured some local taxis that would transport them to the clinic for us. And after the clients were seated and we were working for, say, an hour, we would have a draw. And we would have prizes donated from oral product companies, and somebody who had come to have their teeth cleaned and oral hygiene instruction would also possibly win a power toothbrush. And we ran the whole day that way, fed our volunteers, local restaurants sent the food, and we had it decorated with hearts and balloons, and everyone felt very festive, very happy. The dental hygienists were enjoying each other's company, working some of them together for the first time. And then at the end of the day, we had to pack it all up and see what worked well, what didn't work great, what should we do for next year. And so for 6 years now, we've been running this project. And I can honestly say now, when we decide to run it, it's not a matter of getting together and making all these decisions anymore. Now we start off, we have a local radio station that runs a morning show. Somebody goes on, they interview us, we tell them what our day is about, we give them the phone number. The one dental hygienist takes all the calls, she makes all the bookings, our volunteers come, they work, they enjoy their day. And at the end of the day, we are donating thousands and thousands of dollars in services. We're providing oral hygiene instruction, and we're making people smile as they walk out the door. So I have to say, it's a great success. And it all started with one dental hygiene clinic in Ottawa, Ontario, and now it's reached across hundreds of clinics across the country. So that is just one experience that I've had that's worked so well. I've enjoyed every one of the projects I've worked on, but taking it step by step is the key. You want to make sure that you plan well, you prepare well, and then you can execute your project. We want to know what you're planning to do in IFDH. We'd like to hear about it. We have a site on our website that you can write into us. You can write to Sharon and let Sharon know what you're planning to do. We'd love to follow you along the way. And we'd love to hear what you're planning to do so that we can broadcast it for you. We can share your news with other dental hygienists. Because if you thought of something really unique, maybe other dental hygienists would like to do it as well. So please be sure to fill out a report form from our website, send it to headquarters so we know who and where you are. And hopefully we'll see you in Dublin next summer where we can share all our successes. Thank you, Sharon.
Thank you. Thank you so much, Wanda, for this great presentation. And you have so much experience with the social responsibility projects, not only in Canada, but outside of Canada. And I think we have lots to learn from you. And we appreciate.
Yeah, Sharon, maybe some of our groups may wish to reach out to people, maybe in another country, maybe they want to go somewhere. And there are quite a few dental hygienists that have been able to participate in projects abroad. And we might be able to help you plan it so that you don't run into too many roadblocks, because having a project in your community is a lot different than having a project in another country. There are Ministry of Health issues and visas and working permits, and there are many legal issues you have to go through to work in a foreign country. But many of us have done it. So we actually have the tools to help you. So if you wish to look into a project abroad, then reach out and we can put you in touch with the right mentor to help you to participate in the project of your choice.
That's wonderful, because I know there is interest in having social responsibility projects, not only within the communities in their own countries, but outside the countries. And it's absolutely open. And if you have initiated a social responsibility project, or you're thinking of having one, and you're not quite sure how you do it, well, you have so many tools, you have details and information to assist you to plan. Also on the website, the IFDH website, in the subtitle of social responsibility. You have the website address here, www.ifdh.org. And as Wanda said, you can always, if you have further questions, inquiries, you're not quite sure, you need a little bit of assistance, you can feel free to email me. You have the email here on the bottom of the screen, and you can send the email, and we'll be more than happy to assist you. Now, who can actually apply to the Social Responsibility Project? Well, actually, dental hygienists and oral therapists, as individuals, or if you have a country that is a member of the IFDH Association and plan something which is a national project, they can absolutely apply for the social responsibility project. Submissions of your project towards the end of April 30th. That's the deadline for submission of the project. So you can really feel free to contact us for questions, and all the information is online for you to check out and learn how to initiate your own project. Wanda, do you have anything, or Jill, do you want anything that you would want to add to what have been said? Or
well, after Wanda's presentation, it just really hit me, and hopefully everyone who's listening in, the ripple effect. The example that you gave, Wanda, of Gift from the Heart is so key, because you see how it has become sustainable and has grown year after year. And so the goal of the social responsibility program and the projects that are put together, it's not just for 1 year. Hopefully it's something that you all, once you start your projects and get them underway, can continue year after year and can grow upon. And when you think about a ripple effect that way, you can see how it can be huge. It turns into a tsunami of help for people. So Wanda, thank you for pointing out that wonderful project in Canada, because it is a perfect example.
Thank you. Yes. And I have to say, you know, it's made a big impact on many people's oral health here in Canada, but for dental hygienists as well, because I think no matter what you're going to do, the fulfillment that you're going to get from something like this, where you reach out to the vulnerable in your population, the disenfranchised, you know, the people who have lack of access to care, the way you will feel at the end of the day is worth every moment you're going to invest in it. And until you've really experienced the atmosphere around it, and I think we have just a few minutes left, I'm just going to tell you a quick little story, if you don't mind.
Sure.
About my, well, I've done a number of missions in different countries, but you know, when you actually make someone feel worthwhile, when they feel their self-worth because you've reached out to them, and you think of the people in your society that may not have that self-worth because they are down on their luck, they suffer from mental illness, they may have been homeless. You know, there's a number of these people in our community. Maybe they're in a correctional facility because they've gone the wrong way in life, and now they find themselves feeling well, not worth a lot, and then someone comes along and they want to reach out to them and give them some special attention, talk to them about their oral health, provide some care. And it's the impact is amazing. And I'll tell you, one day I was working in a village in Guyana, and an elderly man and woman came in just as we were leaving for our lunch break. And I said, "Oh yes, come on in, I'll have a seat." No, they said, we're holding you up. And I said, "No, no, no, you're not. I'll still have my lunch. It's okay." I said, "Just sit down. I'm going to give you a glass of water and maybe a granola bar." It was obvious they had walked a distance. So I got them to sit, talk to them about where they had come from. And they had walked for 4 hours to get to this clinic. And their age was hard to determine, they were an elderly couple. And when we were all finished, and I got them settled, gave them a granola bar to have a little snack, I said, "I'll be back in a few minutes. I'm just going to go have my lunch." He reached out and grabbed my hand and he looked me straight in the eyes and he said, "Thank you." And, every time I think of that, the feeling I get, it just gives me goosebumps, because that man felt valued. And that's what that giving that back to someone is an amazing feeling. So, when you're thinking of who to reach out to, and maybe even with COVID, you don't have to be with them physically, but you can be with them in some other way. Maybe you're going to do a video presentation somewhere, where people can't access you, and you're going to reach out and you're going to say, "We value you. We believe you're worth this visit. We believe that your oral health is important to you and to me." And I think that's what social responsibility is about, valuing others and bringing what we can to their lives.
Absolutely. So true. And so we encourage you. We want everybody to have the same feeling. It's also very fulfilling. It's a giving sensation, and being an impact on somebody else's lives for the better. And that's very, very special. And I think that's beyond, it's beyond words. It's what you leave behind and what you have, what you put into other people. And it's amazing. It's a great feeling. And we do encourage you to initiate your own projects. We would love to have your projects presented at the IFDH SR symposium next August. So make sure that you also register to the symposium. You can also find the details of registration on the IFDH website. Early bird registration is until the end of January. So please make sure that you register. And once again, if there are any questions as to the social responsibility projects, details, you have all the tools in the IFDH website. You also have a booklet with examples of social responsibility projects that were presented in Brisbane 2019. There are a few projects there where you can get a little bit of inspiration and ideas as to projects that you would want maybe would interest you to have in your country or in your community. So please feel free to go in and browse the booklet. And if there are any more questions, please feel free to turn to us, and we will be more than happy to answer, share, assist, and follow up with your project. And I think we've ended our session, our presentation, the IFDH Social Responsibility. I would like again to thank Jill Rethman for joining us today. I would really love to thank you, Wanda, for sharing the experience and giving the presentation to all of us. And I would like also to thank again the Social Responsibility Committee for their hard work. We've been meeting during these past year and a half, due to COVID. We were lucky enough to have this new media with Zooming and Teams and sharing our ideas online. So I really appreciate all the effort and the time the committee is putting into having the social responsibility project work for us. And again, thank you also to the IFDH and Des Placerona for their support. And I wish you all a very pleasant morning, evening, night, and we'll see you all, and hopefully we'll get those projects rolling in. So thank you again, everybody.
Thank you all.
Thank you. Thank you, Wanda. Thank you, Jill.